He has founded programs with 8 different diabetes-specific organizations and brought many new concepts to the community as the CEO of ichallegediabetes. Since 2007, maintaining a very low cost for its tremendous impact and growing to be the largest program for youth with diabetes in Canada, serving a holistic approach with mentorship, motivation, and education. So I want to thank all of you for joining us today as we journey to find the uncommon truth about diabetic performance with Chris Jarvis. The type 1 diabetic life Chris has and is living is most definitely one of high diabetic performance. Thank you for joining us, Chris.
Thank you.
How do diabetics and diabetes as a condition deal with the physical, mental, and emotional requirements to perform in life?
Well, thanks, guys. And I think, this first one is actually one of the biggest challenges with diabetes is that as an appearance, it's really hard for anybody else to see. So they call it an invisible disability. And that's because inside of our bodies, our brain and our muscles are all functioning off of this blood sugar level. Most people have no idea, how to balance that. It's just something that automatically functions. And so diabetes inherently means that our blood sugars are going to be out of control. They're hard to put a term of control to diabetes. And what we like to say is management. So we can manage our blood sugars quite well. And certainly I like to demonstrate that with my performance, right? But the physical impact when our blood sugars are not in that target zone where the natural body with a working pancreas would land it, can physically scare you. It can make you shaky and weak. It can make you guess, and wonder and worry about what's going to happen next. And so the physical impacts of diabetes really translate into the mental and emotional impacts.
When people look at me, they just go, how can you be a diabetic? And all of a sudden, they'll see me and I play competitive golf. And I can be playing unbelievably well and literally in the space of 15 minutes, missing a blood test and having an appropriate snack or self-managing my sugars correctly, I go from high performance to no performance. And literally to the place where they look at you and go, what the heck's going on with you? Like, the ball just went straight right in the woods versus where we want it to go. And that's just a simple example of something. When they look at you, you look like you're in physically better shape than other people, but that doesn't talk about the invisible disability or condition that's occurring underneath it. You so eloquently said. But it affects even able-bodied people that don't have diabetes. Blood sugar affects everybody, even in any form of performance. Would you not agree with that, Chris?
I would actually, yeah. And it's something that I've had, you talk about blessings and benefits here, is that when I'm constantly monitoring myself, I'm also learning more about my health and the way I should be treating my body, right? And treating my body for the best performance. Kind of the general comments that we receive on a regular basis, and I think that can affect our mental health, and it can kind of close a lot of people up that live with diabetes so they don't share about and I've been a pretty big advocate that start off right, and you might have someone make a comment that didn't make sense, but I've established some of my best partners and friends from places where they had a pretty low level of understanding of diabetes. And even in the diabetes clinic, I've seen this myself, where a doctor has asked, okay, what kind of range does your blood sugar go to? And it's hard for us to know how to compare against other people living with this condition because you can't see. You don't know how other people are doing it and what the results are. So I always remember sitting in the clinic and feeling the pressure of how to answer that question. And when I was young, like in my teenage years, and the doctor asked if I was having a lot of low blood sugars, I really didn't know what a lot was. And so when they, I asked to elaborate, and they said, well, are you having one a week? And I was like, oh yeah. With doing 60 kilometers of training in a day, there's sometimes 5 or 6 lows in one day. Wouldn't be too surprising. So just knowing that, and knowing that that's a physical barrier that we face regularly, is these things can pile up in one day. There might be a couple of days in a row that I don't have any low blood sugars, right? But when is that going to happen? That can really play a role in whether or not we're able to reach for our best performance.
What percentage of the Canadian population is undiagnosed with diabetes right now?
I think there's been a big push in the last 10 years to try and get that messaging out and provide, constant outreach to get people to consider that and to get tested. So I think doctors are doing a much better job about it, because there was some people living with diabetes for over 10 years, specifically type 2 diabetes. And while we'd like to say that it's gone, there are still times where people come into the office with type 1 or type 2 diabetes, and it kind of gets brushed off. So I still hear stories of people like that in the last couple of years, feeling like something's wrong, and some of them don't know what it is. So, it's hard to guess at how many, but it's really important to know the signs and symptoms, which would be if you're incredibly thirsty and you're using the bathroom a lot, that's because your blood sugar is not going into your muscles and into storage, and your blood sugars are riding higher and higher. So the only thing that we can do is try and drink and get rid of it through using the bathroom.
Excellent. The second question I would have is, given that they have diabetes, a person has diabetes, management of your food intake is amazingly important, your hydration, et cetera. Could you describe some of the things that people need to do, and also your perspective on how many people are actually doing this effectively versus they could really improve it?
Yeah, so when I was younger, this is kind of when you had the options of water or something like Gatorade or juice. So Gatorades and those types of performance fuels have a lot of electrolytes. And so I remember the challenge for me in Athens. Athens is one of the hottest places in the world. And we're out there rowing, and racing for the Olympics. And so I had a really hard time with keeping my electrolytes up and all my micronutrients in balance. And if I had something that was sweeter, then my blood sugar would likely rise. So if I had Gatorade with the electrolytes, then I would be running high and then using the bathroom more and pissing them all away. It's quite frustrating, right? But now we have a whole suite of different products that can help us to balance and get the right nutrition, the right ingredients for our lives. And it is something that, talking specifically to those with diabetes out there, it can be really overwhelming watching our blood sugars. I get that. I feel that. But if we think about it as an opportunity to learn how these things are impacting us and trying to move around some of these ingredients that we're using into the right places, right? So that they can balance out with our daily activities. And I think the extreme nature of what some of us are doing, the act of being out there for around and just hustling all day, and same thing with being out rowing all day, those things can really change the way our hormones work inside of our body. And
I think something that you've addressed is obviously the physical exercise. And my question to you would be, as I know for me, the higher my physical exertion or activities, so when I play a round of golf as an example, or if I'm going to the gym for a workout, a run, just a hike, my monitoring and testing, which means you got to prick your finger, or if you've got the new pod, that's better. You put in a unit. But the truth is, I test in a round of golf at minimum every 3 holes. If I miss one, I invariably will have a low, which will dramatically affect me physically, but not just that, mentally and emotionally. My cognitive abilities to recognize simple little things go down. So do you find that same effect with yourself? And would you say that this is a common thing throughout diabetes 1 and 2?
Yeah, that brings a great point in about what I would be coaching for the last 10 years here, is about creating a routine. Because if you're thinking, do I need to test? Then, it becomes this gamble. And so I had to build a routine into my practice. And so in rowing, I guess it's probably similar to your rounds of golf. And I'm not in your sport, so I'm not entirely sure. But in rowing, you'd race people down the lake. And then in practice, we would sometimes do 8 rounds back and forth. And the coach would actually kind of use the turnaround time to try and really put pressure on us. So that way, if you were the fastest down the course, you would have the most time to recover, right? If you shoot and you get, a birdie, then probably have a little bit more rest time than somebody who's taking a lot more shots, right? So yeah, there's a lot of pressure. And sometimes I think, do I have time to test my blood? And so there was, definitely times in my career where I made a mistake and I decided not to, and it would make me pay the price.
Guessing is what you're talking about. At the end of the day, chance favors a prepared mind. This is something I say regularly in life. I don't care if it's diabetes management, business management, financial management, any form of management requires preparation. And preparation is really stating, create good routines and rituals that will do it. So I shared my golf one every 3 holes. I miss it, I put myself at risk with diabetic management performance.
So with diabetes, you could be afraid of seeing that number because you don't think it's good, right? And you're thinking, I don't really want to see that. Maybe if I just push it along, right? I'll look at it later. That's a very common thing for people with diabetes, and I've done that myself. And if you don't have the information, then you can't make your best judgment to go next. And the same thing would apply running a business, your family relations. If you don't ask the questions, you don't get that information. Do your best on the next step. Even if you find out that you didn't do, exactly as well as you had hoped, you get that information, then you can do better on the next round.
But what's the way that people learn the best way to manage, like their exercise, their hydration, the planning for their nutrition, testing, the whole procedure, so they can maximize their performance?
Yeah. So with diabetes, with type 1, we're recommended to come in every 3 months to see our clinical team. And those appointments are 15 minutes long. Now, in a given day, most people with diabetes are making decisions in the back of their minds or, in the forefront using calculators and things like that for at least 40 minutes of the day. Every day, right? So it's really hard to review all of that with a healthcare team. However, the government pays 15 minutes every 3 months, but there are a great team of professionals that are there for us. If you seek, you will find great team members that are there to help coach you along and to encourage you and to pick apart some of those little areas that might be affecting the whole picture. Now, at the end of the day, we need to be able to collect that information. We need to be using our blood test kits or a sensor and monitoring the food that we're taking in and bring that information to a team member or do our own reflection. And I think that reflection has been a huge part of my success. It's something that I've integrated into my routine, not on an every moment basis trying to criticize myself, but to look back and see some trends. And there's been quite a few times where a trend would surprise me, right? And it's actually surprised my healthcare team. And I've been able to bring some of that information. And I had an exercise physiologist who's one of the top in the world who had just never seen science showing what was happening inside my body. So it's important for us to know that we could be making the next discovery in this disease, right? By doing that work ourselves and bringing it back to a team could help other people to understand what's going on as well. But I do think that there's a definite mix, collaboration between each patient living with diabetes and the healthcare teams out there. For me, it's important to know that we've got to give the team a chance. Sometimes we're looking for an instant gratification in this world, and diabetes can't give us that. So it's important to be humble, be patient, and try to work through a program. Sometimes, like for myself, we as a charity, I Challenge Diabetes, we do a lot of experiential learning programs for people with diabetes. And that gives us the opportunity to learn together and to share insights, things that we have learned along the way. but you can't walk into one of my programs with, I've had over 50,000 participants in our programs over the 10 plus years that we've been in operation. But sometimes we need to see more before we can get that insight, before we can make that change. And so I wouldn't say that there are likely times where someone should be pursuing another clinician. I think some of the signs are what you would look for that. So if your clinician's not listening to you, isn't really looking at your data and is just giving you more of a blanket answer, those are a couple of reasons why you'd want to look somewhere else. And then in terms of where would you go, I would definitely start looking in your local area, and then start to pursue, where the major centers are. And I think, there's a lot of people that are passionate about their clinicians across Canada. So it's not like you have to go to Toronto to find someone. It just happens to be where I live, and I've got a great doctor here. He made a huge difference in my life.